Hello everyone, am I audible and visible? Let me know, then we'll start. Okay, fine. Am I audible and visible? Let me know, then we'll start. Okay, fine. Hello everyone, welcome to Unacademy Future Doctors. Okay, fine. Am I audible and visible? Let me know. Welcome to Unacademy Future Doctors. I'm myself Dr. Dipti Kariya. I'm MD PhD Physiology and I'm Associate Professor educating MBBS, MD students and more than 17 years of teaching experience. Now, let us start with some explanation as well as some things about Unacademy. Here in Unacademy, NEET PG notes are available. These are comprehensive notes for the next. These are curated for from the live classes of Unacademy Educator, well-structured, high-yield exam-targeted notes with their help in effective revision as well as complements the video lectures for respective subjects. These notes are crisp, important topics are focused, and they are based on the latest exam pattern. So to get this, stay tuned. Also, you can accelerate your learning. If you get 1 year subscription, you will get 6 months subscription free. Another is Plus subscription. Here you can choose the best from the best. You can access both live and recorded classes. You can study on the device of your choice. You can learn from India's top educators for your medical exams. You can access question bank, which is having more than 25,000 questions. You can compete in the live test and quizzes. And next, that is our iconic subscription. Here your access to the best from two of the best. And which are these two? One that is Unacademy and Intrapleural. With Unacademy, all the things I have discussed about this subscription, and other that is Unacademy Intrapleural with Intrapleural. Here you can have clinical and integrated essentials, video lectures from the Dream Team, Question Bank 3 with active guidance, system tags and more, rapid revision, snapshots and treasures, and 2021 Dream Notes. Unacademy also launches Unacademy Lite for NEET PG. This NEET PG test series. These are overall 450 plus test series. They include subject-wise test series for all 19 subjects, so system-wise test series for all 19 subjects. Full-length mock test papers are also available. Previous year question papers, test series curated by top educators, and 90 plus grant test including NEET, PG, INI, CET, FMGE, grant test, PYQ series are also available. These are NEET PG 2021 toppers and Focus FMGE December 2021 toppers. Okay. We also have added certain features in our special class. We made the class interactive and live. Have the facility polls for the learner. Raise a hand facility. You can never miss a class as you are always notified for your class. You get lecture notes. You can download PDF notes for the lecture and you can access the class at anywhere and at any time. Another is for 2 months we have PYQ batch. Those who are planning to appear in this May 2022 for the NEET PG PYQ batch, that is for 2 months. Focus FMG 2022 comprehensive batch, that is also for 2 months starting from March 2nd to May 2nd. If you are appearing in the December 2022, this is the batch for you for 9 months, Focus FMG batch. Next, if you are appearing in the NEET PG 2023, that is next. This is the batch for you. This is for 1 year. Okay. Then NEET PG 2022 All Educator Revision batch also has been started. This is for 2 months, 2nd March to 2nd May. Another for 9 months also one batch has been started from 16th Feb to October, and for 4 months the batch started, that is 16th Feb to May 2022. These are our NEET PG subscription. You can either subscribe plus or iconic subscription. You can use your mobile to get the subscription, either plus or iconic. Longer the duration of subscription, cheaper are the rates. Then another is All India mock test, that is scheduled on March 27th, 2022, and this is at 9 a.m. Okay, this March 27th. This is the test for 200 minutes having 200 MCQ. This is All India mock test 1, that is for NEET PG 2022. So you can enroll now. Also, another important announcement, we are launching MBBS Prof 1, your path towards cracking MBBS and next. In-depth comprehensive concept coverage, that is there. Clinical integrated sessions are there. Answer writing guidance sessions are available. Subject wise test every Saturday, followed by discussion session on Monday. Full subject test at the end of subject completion. Live interactive classes with our top educators. Doubt clearing sessions are also there. Recording sessions are also available if you miss the live class, and PDF notes are also available. So now today's topic I'm starting, that is pressure changes during respiratory cycle. Okay. So yesterday we have discussed about functional anatomy of respiratory system. Okay. So now today we will discuss about various pressure volume changes. I think we may be able to complete, or we may not. So but at least today I will try to complete the pressure changes during respiratory cycle. Okay, so you can see here there are various pressures we will discuss, that is intrapulmonary pressure, intrapleural pressure, and transpulmonary pressure. Okay, we will discuss normal pressure changes, as well as what happens during deep inspiration, what happens during deep expiration, what happens during valsalva in standing position, which are the different changes, that also we will discuss. Okay, so starting with the intrapulmonary. Pulmonary means lungs. Inside the lungs, what are the pressure changes during respiratory cycle? Okay, so intrapulmonary means inside the lung. You can see here, or this is another name for this intrapulmonary pressure change, that is intra-alveolar pressure changes. Okay, so this is either intrapulmonary or intra-alveolar pressure changes. You can see here, always I think all of you are knowing that air moves with change in the pressure, means air moves from high pressure to low pressure. Okay, so you can say here, if suppose we have high pressure, uh, one side, you can see here pressure is more here and less here. Okay, so air moves from high pressure to low pressure, but now here you can see we cannot change the pressure of atmosphere. Okay, so now what we can do is we just can change the pressure of our lungs. So that is your intrapulmonary pressure. Okay, air moves, you can see here, suppose atmospheric pressure is 760 millimeter of mercury. This is normal pressure. Okay, and at the end of inspiration and expiration, inside the lung also the pressure is 760 mmHg. But during inspiration, what happens? Because of expansion of lungs, expansion of thoracic cage, there is fall in the intrapulmonary pressure. You can see intrapulmonary pressure decreases here inside this one, less than 760 mmHg. So what happens? This pressure is higher than inside 757, this is 760. So you can say that now air enters inside. So this way air enters. So during inspiration and expiration, what do? Is we are just changing this intrapulmonary. Other name for intrapulmonary pressure is intra-alveolar pressure. Okay, and the gradient is created. Opposite is also true. You can see here, when we are expiring, you can see inside the lung the pressure increases, outside is 760 mmHg, because of elastic recoil of the lung tissue. Okay, and thoracic cage, inside the lung the pressure rises, that is 763 millimeter of mercury. Fine. So what happens here? When the pressure is more than outside, then air moves from inside to outside. So this way there is movement of air because of change in the intrapulmonary pressure. As I told you, during inspiration your atmospheric pressure is greater than pulmonary pressure, or you can say that pulmonary pressure is less than, this is pulmonary pressure is less than atmospheric pressure, so air enters inside. Atmospheric pressure will not change, it will remain same 760. Your alveolar pressure falls, so air enters. During expiration, alveolar pressure, or you can say intra-pulmonary pressure increases, so air moves out. So this is the basic thing regarding the pressure. Now how much is the pressure? You can see here, this is the pressure chart during inspiration and during expiration. intrapulmonary or alveolar pressure. At the end of inspiration, you can see, and at the end of expiration, this becomes zero, or you can say it is equal to atmosphere, equal to atmospheric pressure. Fine. Now, during inspiration, when we are inspiring, as I told you, the pressure falls down. The fall is normal. We are talking about normal inspiration, that is -1 centimeter of water. Okay, and this pressure is sufficient to pull 500 ml of air in the lungs, inside the lung. Because of fall in the pressure, 500 ml of air enters inside the lungs, and this requires 2 seconds. Okay, and this pressure, fall in the pressure, is much higher when we are performing forceful inspiration, and this is known as Muller's maneuver. When we are doing forceful inspiration, there is more negative intrapulmonary or alveolar pressure, that becomes -80 centimeter of water. Okay, and during expiration, again this becomes +1 centimeter of water. You can see here during expiration. This one. Okay, and when there is forceful expiration, suppose with the closed glottis, like in Valsalva maneuver, this may be as high as 100 centimeter of water. Fine. So these are the changes in the intrapulmonary pressure during the various phases of respiratory cycle. You can see here, because of this change in the pressure, you can see 500 ml of air enters inside the lung, and because of this increase in the pressure, 500 ml of air comes out. That is your tidal volume, tidal inspiration and tidal expiration. Fine. Next pressure we will discuss, that is intrapleural pressure. You can see here, this is your intra-alveolar pressure. We have already discussed this one. Fine. -1 during inspiration, 0 at the end of inspiration, +1 during expiration, 0 at the end of expiration. Now we come to intrapleural pressure. Okay, you can see here we have parietal and visceral pleura. Visceral is inside, parietal outside. Between them, there is pleural space. Okay, and the pressure in this pleural space, that is known as intrapleural pressure. Normal intrapleural pressure at the beginning of inspiration, this is -5 centimeter of water. Very important thing here is intrapleural pressure is always negative. Now, what is the advantage of always negative intrapleural pressure? Because when the pressure is negative, first of all, why there is negative pressure? Why the pressure in between this pleura is negative? So what is the cause? Number one is elastic forces of the lung tissue. Lung tissues, they are elastic, so lung tissues, they have tendency to collapse. Okay, and second thing is chest walls, they have chest wall, it has tendency to expand. So lungs are going inside, chest wall is going outside, so in between these two the pressure is falling down. So this is the cause for negative intrapleural pressure. Very important thing, intrapleural pressure is always negative. It will never be positive. Why? Because lungs are pulled inside and chest wall is pulled outside. Fine. Okay, so expansion of chest wall and recoil tendency of lungs. Fine. Now next is what is the normal pressure at the beginning of inspiration? As I told you, -5 centimeter of water. Try to remember these values. These values are from standard textbook guidance. 5 centimeter of water at the beginning of inspiration, and at the end of inspiration or beginning of expiration, this becomes more negative, -7.5 centimeter of water. Okay, now what is the advantage of negative intrapleural pressure? the pressure is negative. So what does it do? What is the advantage? Because of this negative pressure, there is suction created. And because of this suction, our lungs can hold FRC volume of air. What is FRC? This is functional residual capacity. Just a minute. Functional residual capacity. What is this functional residual capacity? At the end of normal expiration, small amount, or you can say 2 liters of air that is present in the lungs, that is FRC, or you can say FRC is equal to expiratory reserve volume plus residual volume. This is FRC, functional residual capacity. Am I clear? So why this 2 liters of air can be accommodated in the lungs? Because lungs, they have negative intrapleural pressure. This is the advantage of negative intrapleural pressure. Now, so again, you can see here, these are various pressures we have discussed. One, that is intrapulmonary pressure. I repeat, it is 0 at the beginning of inspiration. During inspiration, it becomes -1. At the end of inspiration, again 0. During expiration, +1. At the end of expiration, 0. Intrapleural pressure, beginning of inspiration, -5 centimeter of water. And at the end of inspiration, -7.5 centimeter of water. And because of this pressure changes, tidal volume, that is 500 ml of air, inspires and expires. We are inspiring as well as expiring 500 ml of air because of this pressure changes. Okay, now we'll discuss about factors affecting intrapleural pressure. As we have discussed, during normal inspiration, this is only high as -7.5 centimeter of water. But if we are doing deep inspiration, then it becomes more negative and it reaches to as low as -30 millimeter of mercury. Very much negative, you can see. Okay, fine. And during Valsalva maneuver means we are expiring forcefully with closed glottis, means we are not allowing the air to come out and we are expiring forcefully. Here you can see the pressure becomes highest positive, +60 to +70 millimeter of mercury, or sometimes as high as 100 mmHg. Intrapleural pressure we are talking about. Normally it is negative. Now here when we are expiring forcefully, that becomes very much positive. Okay, so that is second factor. Third factor, gravity. Suppose we are standing. In standing position, this intrapleural pressure is more negative at the apex. When it is more negative, you can say that apex gets expanded more. Expansion of apices takes place. So that is the effect of gravity. Okay. Then comes injury. Suppose your chest wall has got injury, and that you can see here, pneumothorax, that is air in the chest wall. So what happens? Normal intrapleural pressure, because the pleura is a closed cavity, so normal intrapleural pressure is your about -5 to -7.5 centimeter of water. Instead of that, because of entry of air, now it becomes atmospheric level, atmospheric pressure. Okay, this is injury cause. This is the reason what happens in injury. You can see here, whenever there is injury, there is pleura becomes an open cavity, so the pressure is equal to atmosphere. Okay, fine. Then next is other disease condition, emphysema. Now what happens in emphysema? You can see here, this alveolar septa are lost. So elasticity of the lung is lost. And when elasticity is lost, intrapleural pressure becomes less negative, or you can say towards positive side, or it may be same as atmospheric pressure, emphysema. Okay, fine. So these are about various factors they affect intrapleural pressure. Let us repeat. Number one, that is deep inspiration, as we have discussed, more negative. Valsalva manure, highest positive, that is the second factor. Third factor is standing, effect of gravity. At the apices, it is more negative, so there is more expansion. Fourth factor, when there is injury, it becomes atmospheric because of entry of air. Fifth, there is emphysema. Sorry, I'm not getting Ali. Whole unit wise. Fine. I am taking classes unit wise, beta Ali. I am definitely taking classes. We have started respiratory system yesterday only. Okay. So today I am taking the class on the pressure changes during respiratory cycle. Fine. Okay. Thank you so much. Thank you so much for your comments and your feelings. Okay. Thank you. So emphysema, there is elasticity is lost, and that also results in atmospheric pressure. Fine. In intrapleural pressure equal to atmospheric pressure, emphysema. Fine. So these are the factors. Now, what is the effect of intrapleural pressure? Yes, I will try to complete it. Yes, I will try to complete the whole syllabus. I will try my best. Okay. So, intrapleural pressure. What is the effect of intrapleural pressure on the cardiovascular system? You can see here, because lungs are there here. Yes, we will try to go unit by unit. Okay. Yes. I have started respiratory system yesterday, Ali, and I'm going to uh, take the respiratory system. Is it? What exactly you want? I am not getting, beta. I have completed CVS. You can go through the channel. You can subscribe the channel, and you can watch my previous videos. You will find all the videos we have completed. You can see we have completed in this channel Unacademy Future Doctors. Let me explain. Unacademy Future Doctors. We have completed general physiology. Okay. Now muscle physiology. We also completed this blood, CVS, and now we have started respiratory system. Fine. Am I clear? Okay. So you go through that channel and you can get all these topics completed. Am I clear? Fine. Huh. Now, so what happens here? Let me explain. Okay. Huh. So let me explain here. We have lungs here and we have heart here, okay, inside the thorax. So what happens during inspiration? Because this intrapleural pressure becomes more negative, so it falls. So pressure decreases. When pressure decreases, you can see here, less pressure is there on this vein, okay, because pressure falls. When less pressure is on the veins, what happens? More amount of blood is coming to the heart. Good. Thank you so much. Thanks for your love and respect. Okay. And all the best for your all future uh, uh, advances and all. I wish you have a very good life. Okay. Go through that channel. You get all the videos. Okay. So subject wise, unit wise, you can learn all the topics easily. Fine. Huh. So again, now we come to the topic. You can see here, during inspiration, as I told you, the pressure decreases, so less pressure on the veins, so more amount of blood is coming, increase venous return and increase cardiac output. So this is one thing. Second thing is, because because when we are doing inspiration, what happens? Diaphragm descends down, so thoracic cavity enlarges, and as the thoracic cavity enlarges, what happens? Venous return increases, and as venous return increases, cardiac output also increases. So you can say that during inspiration there is increase in the cardiac output. So this is the effect of intrapleural pressure on the cardiovascular system. Fine. Now next is opposite is true during expiration when we are performing Valsalva maneuver, as I told you, because we are expiring, so pressure increases. As pressure increases here, you can see more pressure. Let me explain again here. Erase all. When pressure, you can see here, when pressure increases during expiration, so more pressure on the vein, less venous return, less is the cardiac output. So during Valsalva maneuver, what happens? Expiratory muscles are working violently against closed glottis, so the intrapleural pressure becomes more positive. More will be the pressure, decrease the venous return, decrease cardiac output. So sometimes if old age individuals, they are straining much, okay, at the during defecation or any other, or during coughing, so this results in decreased blood flow to the brain because of decreased cardiac output. So the person may have syncopal attack, okay, loss of consciousness, okay, this may be possible. Now third type of pressure, that is transpulmonary pressure. What is this transpulmonary pressure? That is the difference between two pressures we have discussed, intrapulmonary or intraalveolar and intrapleural pressure. Okay, now let me explain how. This is the diagram you can see here. As we have discussed, during inspiration, your intraalveolar pressure at beginning of inspiration, this is 0. Okay, here intrapleural pressure is -5. Sorry, this is 0, this is -5. So what would be the transpulmonary pressure? -5 centimeter of water. Okay, this is transpulmonary pressure. Same thing here. At the end of inspiration, your alveolar pressure becomes 0 again, as I told you, and pleural pressure becomes -7.5. So your transpulmonary pressure becomes -7.5 centimeter of water. This is the difference. Okay, or sorry, this is 0 minus 5, so this is 5 centimeter of water, this is 7.5 centimeter of water. Fine. Okay, so this is your transpulmonary pressure. Now here another important thing is, this pressure, transpulmonary pressure, is less at the base of the lung and therefore and more at the apex. Sorry, I will repeat. Transpulmonary pressure means this is nothing but the difference between these two pressure. Ali, I am repeating the same thing. As I told you, intrapulmonary pressure and intrapleural pressure. Okay. Intrapulmonary pressure, we have discussed normal values, if you can remember. 0 millimeter of mercury at the beginning of inspiration. During inspiration, it becomes -1 centimeter of water. At the end of inspiration, again 0. During expiration, +1 centimeter of water. At the end of inspiration, again 0. Fine. Now this intrapleural is -5 centimeter of water at the beginning of inspiration. At the end of inspiration, -7.5 centimeter of water. So now if this is the difference, this one, so how can we calculate transpulmonary pressure? This minus this, intraalveolar minus intrapleural. This is your transpulmonary pressure. Okay. Now another thing, this pressure again same way as intrapleural pressure, because as I told you, intrapleural pressure is more negative at apices. Okay, so when this is more negative at apices, you can say that this pressure is more at apices and less at bases. So I will explain with the example. You can see at the apex, your intrapleural pressure is -7.5, and at the base it is 7. Okay. We have discussed because of effect of gravity. Okay, now just find out the difference. 0 minus 7.5, 0 minus 7. Okay, so what happens? This transpulmonary pressure is less at the base and more at the apex. Am I clear now? Hmm? Hmm? Okay, so this pressure is less at the base and more at the apex, and this is the reason that during inspiration more of the inspired air that goes to apex first, or you can say when intrapleural pressure is negative, so the air will go here because of the suction. Okay, and another thing, at the end of, if suppose we are performing forceful expiration, what happens? When we are performing forceful expiration, as I told you, this becomes more positive intrapleural pressure. Alveolar pressure will not change. Okay, so this pressure, when this increases, your difference, the pressure difference decreases. Okay, fine. Remember one thing, when intrapleural pressure is more, transpulmonary pressure is less, because it is 0 minus minus. Okay, minus, suppose minus 7.5 is intrapleural, suppose it becomes minus 2, so it increases, so the difference will be 2. This is quite confusing, but try to remember. Intrapleural pressure decreases means it becomes less negative. Sorry, intrapleural pressure increases means it becomes less negative, and decreases means it becomes more negative. This one. Okay, try to remember, otherwise you try to read, then it becomes more easy for you. Okay. Now next is measurement of this intrapleural pressure. How can we measure? There are two methods. Number one is manometric method. Here what we do is, one needle is inserted. This is you can say that is invasive method, so commonly not used. One needle is inserted in the intrapleural space. Okay, and another end is connected to the manometer. So as the pressure changes, your manometer fluctuates and gives you the pressure wave. So you can get that this is during inspiration, maximum it becomes minus 7.5 centimeter of water. During inspiration it becomes minus 5 centimeter. Sorry, during at the end it becomes minus 5 centimeter of water. Fine. So this way we can measure the intrapleural pressure. Second method to measure the intrapleural pressure, that is indirect. This is known as intraesophageal pressure measurement. You can see here what we do is just we can introduce air containing rubber balloon. Air containing rubber balloon. Okay, and this balloon which is having sealed over the catheter. Okay, there is a catheter we are inserting, we have a balloon here. Okay, and that is inserted to the thoracic part of the esophagus, and intraesophageal pressure is recorded, and intraesophageal pressure which is there in the thorax part, that is equivalent to intrapleural pressure. Okay, so we can calculate intrapleural pressure by this way. This is not the direct way. Okay, for that what we have to do is, we just have to insert a catheter with a rubber balloon in the esophagus, and here and another part is connected with the manometer. Okay, and pressure is measured. Okay, and this is equal to intrapleural pressure. Okay, and another thing is, this method is not much accurate, so to make it accurate, this catheter is connected to electrical transducer. Okay, electrical transducers are connected to the catheter to make it the method more accurate, because we are directly, if we are connected with the manometer, this is not very much accurate. Okay, so this way we can measure the intrapleural pressure by intraesophageal method. Okay, so this is all about today's topic. Some of the question may be asked from today's topic is intrapulmonary pressure, as we have discussed. That is also intraalveolar pressure. Just Within 2 minutes, I am just going to complete this. Intrapulmonary pressure is intra-alveolar pressure. How much is it? That also we have discussed. What are the changes during inspiration and expiration? We have discussed. You can see here, beginning of inspiration, it is 0. During inspiration, -1 centimeter of water. At the end of inspiration, again 0. During expiration, +1 centimeter of water. And at the end of expiration, again 0. These are the changes in the intrapleural pressure. Okay, sorry, intrapulmonary pressure. Second, that is intrapleural pressure between two pleura. Here, this is the pressure. This intrapleural pressure, as we have discussed in the beginning of inspiration, this is -5 centimeter of water. It is always negative. Okay, during deep expiration only it becomes positive. During inspiration, this becomes -7.5 centimeter of water, more negative. Okay, and at the end of inspiration, at the end of inspiration, this is -7.5, and at the end of expiration, again it becomes -5 centimeter of water. What is the cause of this negative pressure? Because lungs and pleura, they are pulled in opposite direction. Lungs are, you can say that lungs are recoiling, elastic structure, and pleura, that thoracic cage, that is expanding. So in between we have pleura, and this pleura that acts as closed cavity which has negative pressure. What is the advantage of negative pressure? Because of negative pressure, functional residual capacity 2 liter of air is there in the lungs. Because of negative suction, this air can be there in the lungs. Okay, fine. Next question. During deep inspiration, how much is the intrapleural pressure? It is highest negative, maximum negative, -30 millimeter of mercury. Okay. And during expiration, Valsalva maneuver, forceful expiration with closed glottis, this becomes highest, +60 to +70 millimeter of mercury. It may be as high as 100 millimeter of mercury. Next is, what is the effect of gravity? As I told you, in the standing position, this intrapleural pressure is more negative on the apices. Okay, so instead of -7.5, it may be -8.5. This is more negative because of the gravity. Okay, and injury, when there is injury, again the intrapleural pressure, it is not negative, it becomes positive, it reaches to the atmospheric value. Okay, another is when there is emphysema, elasticity of the tissue is lost. So what happens when elasticity is lost? This intrapleural pressure is towards atmosphere, and atmospheric pressure is 0, so it becomes less negative. Okay, so this is your effect of emphysema. Okay, during inspiration and expiration, what happens? As I told you, during inspiration, this intrapleural pressure becomes more negative, so less pressure is there on the veins. More will be the venous return, more will be the cardiac output. So cardiac output increases during inspiration. Second cause for increase in the cardiac output, because diaphragm descends down, so volume increases of the thoracic cavity, and therefore the cardiac output increases. And during expiration, you can see here, because this intrapleural pressure becomes positive, there is pressure on the veins. More pressure on the veins, more will be, sorry, my battery is down. Let me just start it, then only we can continue. Sorry for the interruption. So because of lack of battery, I am closing my class today. So thank you so much for the class. Okay, thank you so much for the class. Thanks for watching me. I'm closing my class because I have a lack of battery. Sorry.